Initially, I got diagnosed with fibroids, an episode in the ER, and I wanted to get rid of them immediately. I came to Dr. Harris, and he told me I wasn't a candidate because I didn't have any symptoms. A year later, I started having unmanageable bleeding, and that's when I started looking for solutions. I went to 2 different OBGs who wanted to give me a hysterectomy, and then I came back to Dr. Harris hoping that this time I was a candidate, and I was.
I waited 3 years. The first symptom was 3 years prior. Obviously it was intercourse. Then after that, then it was the bleeding was heavier. Then it seemed like my bladder was affected. Then I was nauseous and vomiting. Okay. So I couldn't ignore it any longer. And that all happened within 4 months. I called in and said I need to come in and do the consult, and so I had the consult and I had my surgery a month later.
I needed to actually have surgery. I knew that going in. It was about 3 years before I actually had the fibroid treatment surgery. My husband and I were trying to have a baby, so we waited as long as we could, and the bleeding got so bad that I got to a point where I had to make a decision on if I wanted to have surgery or not.